Sternocleidomastoid, or SCM for short. This is the most superficial, largest muscle in the front part of your neck. In this video, I'm going to show you how it can cause neck pain, headaches, cervicogenic dizziness, and a host of other really strange symptoms. As well, I'm going to show you how to treat this muscle at home to help alleviate dysfunction in your SCM. My name is Dr. Jon Saunders, and today I'm going to discuss how the sternocleidomastoid, or the SCM, might just be the cause of your problems. Before we get started, I'd really appreciate it if you hit the subscribe button below in order to stay informed of our new video uploads. My goal is to provide you with some valuable content that you can help yourself in the comfort of your own home. The sternocleidomastoid gets its name from its origin and insertion. So the sternocleidomastoid originates from two different parts of the lower neck, the sternum and the clavicle, the sternocleido, and it rises up to attach to the mastoid process of the temporal bone in the back of the neck. Hence the name sternocleidomastoid, although people just call it SCM for short because it's much easier to say. This muscle is quite complex in that it allows you to turn your head as the muscle shortens. You turn your head to the opposite side. It also allows for some lateral flexion. And finally, it allows you to flex your neck forward when both sternocleidomastoid muscles contract bilaterally or at the same time. This muscle is also very interesting in terms of the symptoms it can create when it's not working properly. Things like headaches, neck pain, decreased range of motion, wry neck or torticollis. However, there are more complex symptoms that can arise. Things like lacrimation, facial pain, blurred vision, equilibrium problems, dizziness problems originating from the neck. We call that cervical vertigo or cervicogenic dizziness. Eyelid twitching, redness in your eye, sinusitis, even a sore throat, ear popping, and just lowered spatial awareness. So as you can see, there are somewhat strange symptoms sometimes that can arise from dysfunction of your SCM. So what can cause problems with your SCM or SCMs? Infections and tumors, although this is quite rare. Trauma, like a car accident or a sports injury, can damage an SCM. But probably the most common cause of SCM irritation that I see in clinical practice is poor posture. Poor posture from looking at our phones, from spending too long in front of our computers or our TVs. We're sitting more than we've ever sat. Poor posture and sitting too long is the most common cause I see of malfunction or dysfunction of the SCM muscle. So what can you do at home to help alleviate some of those symptoms I just discussed? There are two things that you can do very easily that can help tremendously alleviate some of the problems with a dysfunctioning SCM muscle. One involves trigger point therapy or ischemic compression to trigger points within the muscle, and another one is stretching the muscle. What I find the most important thing is that you work out the trigger points prior to stretching for it to be the most beneficial to help with an SCM problem. The first thing you're going to do to find trigger points is you're going to use a pincher grasp. In order to find the muscle, you're going to turn your head and slightly flex down, and the muscle should pop out. As you can see, you're going to grab the muscle between your thumb and your index finger, and then you can come back to center. And what you want to do, you want to palpate or put some compression all the way up and find any tight or trigger points that elicit some pain or referred pain. You'll know you're on one when you find a tender spot. There is one right there. And as I compress very gently, I can feel that refer to the back of my head. So I know that's a good indication of an area of the muscle that might not be functioning properly. So you want to put a little bit of pressure and you hold it for a few seconds or until the sensation of the referred pain or discomfort minimizes. But what you want to do is work your way all the way up, finding tender nodules or trigger points and compressing them very gently to elicit some of the discomfort. In fact, you could elicit some of the symptoms we talked about, things like headaches, neck pain, dizziness. These could all be possible from trigger points within your SCM muscle. And you can work right up to the base of the skull, the mastoid process, Oftentimes there's trigger points or tender points at the origins and the insertion of the muscle. So to find the origin, what you want to do is you want to flex the muscle and you want to feel there are two areas where the muscle originates. The clavicle, which is the collarbone, and the manubrium, or on the sternum. And as you flex the muscle, you can kind of feel both areas. So these are good areas to look for trigger points. Be gentle. There are some sensitive tissues below this muscle, some blood vessels and nerves. You want to stay away from those. But you can be on the muscle and just work your way from the bottom all the way to the top. And just gently, when you find a nodule or trigger point, treat it very, very gently, specifically until the discomfort or the referred pain diminishes. Make sure you check both of these muscles for trigger points or tender nodules before you move on to the stretch I'm going to show you next. This muscle can be stretched a variety of ways. I'm going to show you two stretches that are my favorites that I find work best to help people alleviate tension or tenderness in your SCMs. Like I said, start with the trigger points and then move immediately to the stretches. So the first step in this stretch, so we're going to take the neck and we're going to just simply keep the shoulders down, simply move to the side, move the neck all the way, and you might want to put a little more pressure with your hand. Feels really good. Hold the stretch for a minimum of 30 seconds for at least 2 to 3 times a day. I'm going to show you a stretch now to help stretch out the bottom part, both at the clavicle and at the sternum, or the clavicle here and the sternum here. What we're going to do, we're going to turn our heads, we're going to extend slightly back, and you're going to really feel that when we actually move down, you're going to feel it at the clavicle part, and if you move slightly up, you'll feel it closer to the center at the sternal part. One thing you want to be careful about if you know you have underlying neck problems is sometimes when you extend your neck, it can irritate the joints at the back of your neck. If any pain happens in the back of the neck when you're doing this stretch is probably not for you. For another video on a few of my favorite stretches for the upper neck that can help with neck pain, headaches, postural issues, and cervicogenic dizziness, click right here and go watch that video right now. If you suffer from cervicogenic headaches, these are my 2 favorite stretches for cervicogenic headaches that stem from the upper part of the neck. Click right here if you suffer from headaches. Thanks for watching. See you on the next video.